And while case numbers may be falling, the discussion about how to treat COVID continues on the Kansas side at the State House in Topeka.
Yeah, state senators reviewed a bill today for the first time that would require pharmacists to fill prescriptions for certain drugs, whether they want to or not. Fox 4's Jacob Kittelstad joins us now live from the KU hospital tonight. And Jacob, leaders in the health system are now criticizing this legislation.
Well, yes, this bill has everything to do with those anti-parasite drugs that you may have heard about, ivermectin and hydroxychloroquine. Now, this bill says that if you have a prescription for one of those drugs to treat COVID-19, a pharmacist cannot reject that prescription. It also says that you cannot sue your pharmacist or prescriber if you have a bad reaction to the drug.
Excuse me. Thank you, Mr. Chair. Members of the committee, Senate Bill 381 is related to the authorizing and prescribing of prescription drugs for off-label use to treat COVID-19.
The bill, pushed by Hutchinson State Senator Mark Steffen, waves away some existing Kansas state law giving pharmacists some discretion by saying that pharmacists now shall dispense drugs like ivermectin and hydroxychloroquine.
Shall dispense. So the key word here is shall, because they no longer have, so that they can't, the pharmacist can't.
They could not refuse.
Not refuse.
So this is anything but unique.
But doctors in the KU health system say this is an example of the Kansas legislature wanting to practice medicine.
What the Kansas legislation is trying to say is, well, look, if you want to use ivermectin for COVID, even though that's off-label use, and let's be honest, even though the overwhelming weight of scientific evidence says that it doesn't work and may even be harmful to you, because again, this is really a drug meant for parasites. What happens is that the Kansas legislature is now saying you can't be held responsible for any bad outcome.
But in Topeka, nearly a dozen doctors are poised to speak in favor of the legislation. Some miffed that this committee did not hear testimony today.
We do have a hearing scheduled all day tomorrow as well.
Excuse me, we have doctors here who have to cancel their patients today to be here. I don't know if they can come back tomorrow.
Okay, well,
Care about their patients.
ma'am, I do care about that, but unfortunately there is another meeting here right after ours.
Now, this bill would also retroactively seek to reverse disciplinary actions taken against prescribers and pharmacists who may have prescribed these drugs, basically wiping records clean that may have been detailing unprofessional conduct. This discussion is continuing at the Kansas Capitol tomorrow. Jacob Kittelstad, Fox 4, working for you.